Professor Glaucoma IC as the co-chair and Dr. Arif as the moderator. So the first speaker in this symposium will be Dr. Lubna Adib. She will talk about frequency of ocular diseases in patients presenting at Eye Department, Fauji Foundation Hospital, Peshawar.
Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Lubna Deep from Fauji Foundation Hospital, Peshawar. My topic of presentation is frequency of ocular diseases in patients presenting at Eye Department, Fauji Foundation Hospital, Peshawar. Purpose of my study is future formulation of healthcare plans for ocular disease management at Fauji Foundation Hospital, Peshawar, and to allocate resources for healthcare education of patients according to disease frequency, and also awareness of eye disease among fellow doctors of Fauji Foundation Hospital, Peshawar, as it is a multidisciplinary hospital. Material methods. It is a retrospective cross-sectional study conducted at Fauji Foundation Hospital, Peshawar Eye Department. Its duration was 7 months from 15 January 2022 till 15 August 2022. Data was collected via HMS. IRC approval was obtained. Inclusion criteria was all male and female patients attended IOPD were included in this study. Patients with refractive errors were excluded from the study. Results. Total number of patients were 2,959 in the study period. Male-female ratio is 1:9. You can see female patients were 90% that were reporting Eye Department, Fauji Foundation Hospital, Peshawar, because Fauji Foundation Hospital offers services to families of ex-servicemen and employees of Fauji Foundation and their families. This is the disease. This slide shows diseases and their frequency that presented to IOPD, reported to IOPD. As you can see, blepharitis is the most common disease that we found in our study. It is 14.80%, followed by allergic conjunctivitis and cataract, and many others as well. I compared my study with two other studies that were conducted in the same city, Peshawar, but two different hospitals. In the difference in their study and mine was, in their study, cataract was frequency of cataract was 57%, but in my study, it was 11.45%. So that was a huge difference. But as far as other diseases are concerned, like pterygium and squint and glaucoma, they were comparable. Both those studies show low frequency of glaucoma patients, as well as I saw in my OPD. In my study, the most common disease was that we found most common disease was blepharitis, and it was 14.8%. There was an international study conducted at USA by Lamp et al. He also concluded blepharitis is like a common disease, and he concluded 37% of patients in his study. Second most common disease that we concluded in our study was allergic conjunctivitis, and its frequency was 12.5%. Rashid et al. And Nelson, they both concluded in their study about 15 to 20% of cases with allergic conjunctivitis in children and elderly population, respectively. Conclusion of my study was that the most common ocular disease in our study was blepharitis, followed by allergic conjunctivitis, cataract, and retinal vascular disease. Overall frequency of glaucoma was low in our study, that was comparable with other regional literature. This is the most important slide. As I told you, 90% of patients were female that attended IOPD, that were reported to IOPD at FFH Peshawar. So the arrangements had to be made accordingly as the female patients are concerned. And second most important thing that we did after concluding our study, we rationalized our budget according our budget of our department according to frequency of diseases. Like when in our study, the blepharitis and allergic conjunctivitis were most common, so more money was invested for buying medicines for these patients as well, not just the cataract patients. And the fifth most common disease was diabetic retinopathy. So we also invested money on buying IVAs, and we started IVAs in our setup as well. Thank you.
Thank you, Dr. Lubna. The next speaker, Dr. Arif Hussain, he is going to talk about eye examination by optometrists at RSC Center, results of the pilot in Chakwal and Laya.
Thank you very much, sir. 4 years back, we started the idea to start the optometry services at the rural health centers. And this is the advanced primary eye care services which we wanted to establish at the rural health centers. And in this regard, we got the support by the CBM Germany and also by the Peak Foundation UK. So along with these three collaboration, we started the project, and we are going to show what was the impact of this 4-year project. This is a unique project, as we have not done this thing in the Punjab, that we have some optical services at the rural health centers. In this particular presentation, we will be focusing on what is the process, how peak function, OPD and refraction. And secondly, we will be seeing what is the impact of the training on this on the lady health workers, the lady health supervisors, and the school teachers and the optometrists. So we will be looking many of the results that you can see automatically what was their efficiency and effectiveness. And automatically this program provides the mechanism of monitoring of the optometrist and monitoring of the lady health workers and monitoring of the lady health visitors. And in this way, we will be able to convince the authorities that what is the rationale and why it is important to have the optical services at the rural health centers. We did some situation analysis. Physically, we visited all the centers at these two places, district Chakwal and Laya, and it is a paperless mechanism in which every participant, every person involved in the screening uses the Android mobile, and this mobile provides the software is available on the net, and but it is you have to get the certification before use. And for each level of the services, there is a software that how we'll be using it at the lady health workers, how we'll be using for the teachers, for the children, and how we'll be using for the optometrists sitting at the rural health centers. So all the services, all the primary screening that merge at the second square, at the optometrist level, at the triage level. Then patients are examined, and he is able to see that whether the referral were truly okay, they were right referral, or they were false positive. Sorry. And one thing is additionally is incorporated in this project is that the optical services. And after the optometrist examined the patient, the patient is referred to the optical services, and that patient comes, when he reaches there, the loop is closed there. Otherwise, if he send the patient to the secondary level at the THQ, then there the examination is done by the ophthalmologist, and then the loop is closed. This is a patient get the SMS, so he can go to the concerned rural health center or the concerned THQ for the checkup. This project involved extensive trainings, IT support, and infrastructure development at the rural health centers, and definitely employment and deployment of the optometrist. and we have to teach the lady health workers, lady health visitors, and the optometrist how they will be working on this Android. And there are a few trainings, and this project is in the two districts, but there in these two districts there are 6 tehsils in which we are working on this project. There are 24 rural health centers which are working under this special peak screening project. This is the number of the total human resource involved in the screening purposes, primary screening purposes, whether it is the BHU level or it is a lady health worker level or it is a teacher school level. So there are a lot of human resource involved which are trained, then they refer the patient to the rural health centers. And in the last 4 years, there was maybe 1.5 years which was we suffered the corona here, but still we were able to get almost 860,000 population screened. And this table shows that what was the breakup of the different tehsils in which they have been working, and they were referring the patients. This was the monthly breakup, and this is very useful, a very simple slide which shows not only the overall efficacy and effectiveness, it also shows the training level of the lady health workers and our school nutrition supervisors and also our lady health workers. And you can see that out of the total 110,000 patient who were asked to go to the rural health center, out of them 77% of them they physically visited. This is a very, very big achievement, and paper says that if this figure is more than 20, it is more than enough. But we have 70% of the patient who were referred there and who have physically attended the rural health centers. And interestingly, all of the patients who came to who were found who were attended the rural health center, out of them 93% of them they have disease. They are true positive cases, and only 8% of them were true negative. They were not having any disease. So that shows the effectiveness and efficacy of our primary screeners. This is the overall picture, and this is the picture by the lady health workers, picture by the BHUs. BHU were the first part of interaction in which we interacted and we started our work, and they are the most efficient, and they have most clearly they have shown their work. And lady health visitor, they screen the patient, and out of those specific sample, you can see the true positive level is almost 93. Coming to the gender breakup, we have seen that most of the patients are female. You can see out of 94,000 patient, 58,000 of them were female. Again, as I mentioned, that the BHU staff the most strongest outlet of the primary screening in this project, and this shows the age breakup. Most of them were female, and they fall into the age group of 20 to 40. And similarly, this was the school screening sample, and here you can see they were equal distribution of the gender. This all the tables and graphs which you are seeing here, they are not made by me. It is a software which automatically generates these things, and we can see the individual efficacy and presence and effectiveness and their quality of referral of the individual worker involved in this whole project. And this is the name of the different optometrists who what they have done during the last 4 years, and how many of them were having purely disease or not, and how many of them were referred to the next level. So this is interesting that on average each optometrist has examined 3,500 patients during this 4-year period. This is a big good. I think that at one RSC where there was no eye care setup, now they have examined 3,500 patients in that particular RSC. I think that this slide, Professor Asad is sitting, and he was the pioneer to start this thing. And all the activities which we are now taking down to the rural health center, we need to promote this thing. And we are lucky that we have a presence of so many audience here. And now we are on a stage that we should start strong advocacy that we could have the optometrist clinics at the rural health centers. And there's a need, because it's a new phenomena, there's a need of clinical supervision and monitoring of those optometrists who are working alone. They are not working under the ophthalmologist. So it is important that at early stages we need to supervise them. And in the last, I think that when we do so much thing at the rural health center, and we examine and we prescribe the glasses, and if there is no optical shop available, then they have to go to the bigger center and they have to go to the main city. So there is a need to establish the optical shop in the nearby area. So that will the real success of those advanced primary eye care at the rural health level. Thank you very much. And any questions you can ask, please.
Dr. Arif, I think this peak technology is going to revolutionize the eye care in Pakistan. Started by CBM, and now Sight Savers is also taking it up, and hopefully what Dr. Farooq Sahab is thinking to start. But this is very good. I think all over the world, developed world, this is how they work. Referral from primary to secondary and then to tertiary. Our dilemma is that patients are coming directly to tertiary, and I won't say that they are wasting our time, but in fact they are diverting our attention from more complicated cases. So these patients, 80% of them, they can be tackled at DHU and THU level. So thank you very much, CBM, and in anticipation, Federal Foundation and Brian Oldie. So next speaker, I request Dr. Junaid Faisal Wazir to present success story of Pakistan Trachoma Elimination Project 2019 to 2022.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Allahumma rabbi sharh li sadri wa yassir li amri wa ahlul 'uqdatam min lisani yafqahu qawli. So it's a long history, starting way back 1998 and early 2000, that we start struggle how to eliminate trachoma from Pakistan, because Pakistan now it is still among the endemic countries which having the trachoma, which is the leading cause of infectious blindness. It's having the threshold which is high above the public health problem. So it is within the domain of the public health problem, and we are struggling since 2000 that how to cope with and certify Pakistan as trachoma free country. These are the partners in which they supported us in this journey. That is the WHO, Federal Health Ministry, IAPB, all the provinces including the AJK, the College of Ophthalmology and Allied Visual Sciences, Sindh Institute of Ophthalmic Visual Sciences, and Pakistan Institute of Community Ophthalmology, and our esteemed INGO partners, that is the Fred Hollows Foundation, Site CBM, and Water Aid. So this is just a content which we will just have a very brief glimpse. That is the trachoma background in Pakistan, a very brief history again, the district and the stakeholders which are involved. So I'll take one by one. Again, I will say we started this journey from 1998 with a mission that one day Pakistan will be certified as trachoma-free country. With that is, we will get the certification for the elimination of trachoma for Pakistan. So for that very reason, we have started from the scratch, and we need to have some background information with us. That is what we call is the baseline information or the baseline data. So this slide shows all the information which come through different surveys, through at different time and point and place. So this shows all the details of the surveys which come under the heading of the baseline surveys.
Screens का order दे दी.
Yeah, the project brief is, the goal is that is to reduce the extreme poverty through elimination of trachoma. Purpose of the project, that is Pakistan has achieved the WHO criteria for the trachoma elimination by GET 2020. So the GET is the Global Elimination of Trachoma 2020, by the year 2020. Now it has been scaled up to 2025. And the objectives are, that is the active trachoma and treated in the endemic districts, that is ongoing trachoma transmission. If it is the active trachoma is there, that is by some interventions like a public health intervention, that is FNE, face wash, environmental change, hygiene. So these were the different approaches which were adopted. From 2018 to 2022, that was a 4-year project, which is now ended up in June 2022. And for the next 3 months, we had a transition plan, which end up by the September 2022. So the different donors which supported us, that is the UKAID, DFID, Commonwealth Funds, Australian NGO, that is project implementation will based on the WHO endorsed, that is the SAFE strategy. For the trachoma elimination, the WHO has designed, we all know, that is the SAFE strategy. S stands for the surgery, A for the antibiotic for the active disease, F and E is for the face wash and environmental change. So the last two components, they are not directly eliminating trachoma, but it has got a major role in controlling trachoma, in eliminating trachoma by improving the personal health hygiene and community, that is the sanitation. The project, right. So the partner NGO which supported us, again, that is the Fred Hollows Foundation, Site Savers, the CBM, and the Water Aid. The different provinces that were involved in this project were the Khyber Pakhtunkhwa and the districts, it's listed there, the Punjab, Sindh, the Gilgit-Baltistan. I will not go in detail of each and everything because the limitation of time, it's almost ended up. And again, the project implementing partners were, which I said earlier. So this slide is important. For eliminating trachoma, the WHO recommend that whenever the active disease is more than 5% of the total population in the age group 6 months, 1 year and above. So this come under the heading of the active trachoma. And for that, we have to go for some intervention, that is the SAFE strategy. And if the blinding trachoma, which we call the trachoma trichiasis, if the disease is more than 0.5%, so that come in also, that is the in blinding trachoma. So for that we go for the surgical interventions. These are the GTMP surveys results. Again, so these are the picture which we had. The surge is different. Thank you very much. If some question, I'm here. Thank you very much.
Now I will request Mr. Farooq Aman, Country Director of Red Rose Foundation, to present his presentation.
I would request Professor Asad Aslam, Chairman of the National Task Force, we all request to kindly expedite the dossier process.
We have already worked on this. Our only limitation was hiring a consultant to develop the dossier, and the WHO has recommended us the consultant and the amount needed for it. That is about $50,000, and we are very extremely grateful to Fred Hollows, CBM, and Site for committing that $50,000 for development of dossier.
यस वो सर कैमरे के सामने आपने यस करवा दिए
तुम्हारे लिए यही करना चाहिए
So thank you very much. My name is Farooq Awan, and I am country director, Fred Hollows Foundation, Pakistan. Today I am going to share a success story, though my presentation would be little different from the other presenters. So I'll not presenting any disease data in this, but I am going to present a very important side, because whatever we do, we actually need resources, be it procurement of equipment, be it the service delivery to the communities. So resources are very, very critical, and that is very important. And how to raise resources, this is the one way that we followed with the support of provincial coordinator Azad Jammu and Kashmir, and we were able to successful at the end of the day. And this whole work has been done under the chairmanship of Professor Dr. Asad Aslam Khan, and on the ground Professor Wasim and particularly myself from Fred Hollows were working on this. So that is a success story I'm going to share with you all. About Fred Hollows Foundation. Fred Hollows Foundation is Australian international development organization. We have been working in Pakistan since 1998. At present, we are in 26 countries around the world. How did we start this whole initiative? And at the end of the day, we were able to raise 100 million rupees from the government of AJK. So this journey started with the appointment of a new Secretary Health in the Health Department of Azad Jammu and Kashmir, and Provincial Coordinator Professor Wasim, who is also with us in the Health Department of Azad Jammu and Kashmir, and Provincial Coordinator Professor Wasim, who is also with us in the room. He was kind enough to organize first meeting with the Secretary Health, and then uh, there was another meeting in which all the stakeholders were present, and then Secretary Health showed some interest in the development of eye health, though eye health is a very small kind of specialty within overall health system, but he was kind enough to show interest, and we were also very happy to support that initiative. And after a couple of sessions with Secretary Health and his team, first meeting of Provincial Eye Health Committee was convened, and to be able to understand the magnitude of the issue and create a roadmap for development, it was agreed to develop eye health plan after the completion of situation analysis. So this was the committee which met for the first time after long time, when Professor Wasim took over as provincial coordinator, and obviously new Secretary Health started his work in the health department. And this was the request that was put forward to us by the health department, that they are interested to do the situation analysis of eye health in the AJK, and then after that eye health plan would be developed. So this was the situation analysis that was completed in 2018, in which all the stakeholders were invited, and this was done under the overall umbrella of National Committee for Eye Health. And after that, after the completion of situation analysis, then we were able to support for the development of eye health plan. So this was the stakeholders consultative meeting convened in Muzaffarabad to be able to develop a provincial eye health plan. So provincial eye health plan was developed, and it was endorsed by the health department. The Honorable Secretary and Honorable Minister for Health endorsed the eye health plan. And at that point in time, Secretary Health was retired. The Secretary Health whom we started our work, and new Secretary Health took over. So the outgoing Secretary Health formally presented that eye health plan to the new secretary and requested him to take it forward. So after that, PC1 was developed, and this PC1 started from 700 million, and finally it was approved for 95 million. But we are still very happy that something has been done over there. So how that PC1 was approved? So this is a kind of journey that we had throughout this time. Professor Wasim and myself, we engaged with the health minister, and back then the health minister was also a finance minister as well. So it was a 2-in-1 combination, very helpful for us. So we took him to LRBT Hospital, Karachi, and showed him how eye health works. So he was quite moved and motivated after that visit. And then afterwards, we have successive meetings with the Secretary Health. So you can see myself and Professor Wasim working very hard and meeting and engaging Health Minister every now and then. And after that, once the PC1 was approved and resources were finally allocated, now 13 positions of optometrist has been created out of this PC1. And they have already been employed, and with all other developments that took place in district level and tehsil level hospital across AJK. So what was the key learning out of this whole journey? The first learning that I would like to share is that identify your advocacy purpose, and then try to find who can help you in achieving your purpose, and then build trust and rapport with your identified person and department. Maintain regular contact with the identified person, and keep him or her updated on your issues and purpose. And in addition to that, obviously this is a long and tedious process. It cannot happen overnight. So we started this journey in 2017, and we were able to be successful in 2021. So it took a lot of time. And during this journey, it is important that you identify areas and try to offer required support to the person department whom you are in contact. Especially in this case, we were helping health department in developing PC1 and all those documents, and recognize and appreciate unsung heroes, particularly in this case, Mr. Javed and Mr. Khwaja Adil. These are both deputy director within health department. They were very helpful, and they were actually moving papers and files within the health department. And then be patient with the process and system, and don't try to make shortcuts. A reciprocity approach should be adopted, establish relationship and then maintain them. And in addition to that, door and foot approach is also needs to be applied, where you start asking small things and then gradually go up. So with that, I would like to, at the end, I would like to acknowledge who have actually supported us throughout this journey. So Honorable Health Minister Dr. Najib Naki Khan was instrumental in supporting this whole initiative. In addition to that, successive Secretary Health who led the eye health department in AJK, they were the one who was supporting us, particularly General Khalid Asad, who actually started this process. Then obviously successive Director General Health and their teams were very helpful. Then obviously our one and only Professor Dr. Wasim, who is Provincial Coordinator, who was instrumental in supporting this initiative. Obviously Dr. Asad, since Dr. Asad led the National Committee for Eye Health, so his support was there. He always supported us wherever we need his support. Al Shifa Trust Eye Hospital supported us into this. Dr. Haroon Awan and Mr. Bashir Khan from Avicenna Consulting firm, they actually supported us in developing whole documents and eye health plan. And then INGO representative, Ms. Munaza Gilani, Dr. Zaid Awan, Mr. Khalid Saifullah, and FHF country team. So with this, thank you very much. I guess if Professor Wasim is there, if Professor Wasim wants to say something, so over to you, Professor Wasim.
थैंक यू वेरी मच। मैं प्रोफेसर असद असलम और फ्रेड हलोज की कंट्री डॉक्टर मिस्टर फारूक अवान का बहुत शुक्रगुजार हूँ। एक्चुअली दिस वी आर स्टिल प्रोग्रेसिंग इन दिस रिकॉर्ड। और उसके बाद जब ये हमारा ये जो सिचुएशन एनालिसिस हुआ, उसके बाद फिर हमने अल्हम्दुलिल्लाह नाउ AJK में फर्स्ट पोस्ट ग्रेजुएशन इंस्टीट्यूट मीरपुर में डेवलप हुआ ड्यू टू सपोर्ट ऑफ नेशनल आई हेल्थ कमेटी। और अब FCPS और MCPS की ट्रेनिंग AJK में स्टार्ट हुई। और उससे पहले हमारे जो कि ट्रेनिंग पेशावर, लाहौर, इस्लामाबाद, कराची जाना पड़ता था। तो अब अल्हम्दुलिल्लाह ड्यू टू दिस लॉन्ग जर्नी हम अब ये अचीवमेंट हमारी ये है कि वी आर नाउ प्रोड्यूसिंग ओवर ऑन ह्यूमन रिसोर्स रिगार्डिंग इन आई केयर सर्विसेज। Secondly, second thing, due to this, advocacy, we have trickled down the optometrists now in Tahsil headquarter hospitals. We have established 7 Tahsil headquarter hospital where eye care services being provided by optometrists. Although we are not equal to the all other provinces, as they have started in rural health center as well. But ड्यू टू दिस लॉन्ग और एक आइडेंटिफाई करके सिचुएशन को जो हमने प्रोग्रेस किया उसका अल्हम्दुलिल्लाह ये है कि अब वी आर गोइंग टू डेवलप सर्विसेज एट लीस्ट एट सेकेंडरी एंड प्राइमरी लेवल। थैंक यू वेरी मच।
To present the evaluation of the eye care services in Pakistan.
Bismillahirrahmanirrahim. I'm just going to share with you about the evolution of eye care in Pakistan. I have been into this for the last 25 years, and we have been doing this slowly and steadily. But the amount of effort now being done by our successors, particularly Professor Wasim in AJK, and I would appreciate the way the prevention of blindness has been looked after in Punjab by Dr. Professor Zaid Kamal. So I really appreciate, because he has touched all the areas which we have ignored, and he has promoted all those areas on which we were working. So thank you very much for taking care of prevention of blindness and eye health in Pakistan. Just to apprise to everyone about the evolution of eye care in Pakistan, this is not a job done by a single person or a single organization. This is a job done by the National Committee for Eye Health, ministries, provincial health department, and international and national NGOs as our partners. We must acknowledge the Ministry of Health, provincial health departments, national and international NGO partners and corporate sectors, national NGOs, WHO headquarters, WHO regional office for EMR, WHO country office, and International Agency for Prevention of Blindness EMR office. They have every single institution has helped us a lot to reach where we are now today. Pakistan Eye Care Program is a journey of more than 4 decades. I am just the torch bearer. In fact, it was started by Professor Saleh Mehman. It was strengthened by Professor Muhammad Daud Khan Sahab, and it was handed over to me to carry on till now. Situation of eye care in Pakistan at the time of creation of Pakistan and revealed by subsequent survey and mapping is like this, that we all know that 1947 saw the freedom, partition of India and birth of Pakistan, a mixture of joy and sorrow. Indo-Pakistan wins freedom, but the partition caused death, disease, destruction and displacement of some 20 million people. In 1947, there were only 6 specialists, not eye specialists. They were all major general specialists, general surgeon, physician, and others, not eye specialists. Only 42 medical officers in Pakistan. They were not working in eye department. They were working in other areas. They were mainly in Punjab. Paramedics and nurses, they were very negligible. Only the volunteers they used to work in hospital at that time, after the creation of Pakistan. Then in 1947, there were also few missionary hospitals, Sir Holland and Son, Quetta, Shikarpur, Novel Christie, Taxila, Mayo Hospital, Lahore, Civil Hospital, Karachi, and few family-owned cottage eye hospitals. This is all what we had in 1947. Then came the era of 1950 to 60. New eye department came up in public sector in Karachi, Multan, Peshawar, armed forces. However, there were no organized services available to 80% of the population. This was the turning point, the wake-up call. WHO sent Professor Hugh Taylor from WHO. He is an Australian ophthalmologist, to go to Pakistan and do a situation analysis or survey, national survey. And his findings were very disappointing. Only 80 ophthalmologists for 100 million population at that time. Gross human resource mismatch, cataract major cause of blindness. 45 out of 64 districts at that time, there were only 64 districts in Pakistan, were without ophthalmologist. And he said Pakistani ophthalmologist is doing half a cataract per day. This was his report submitted to WHO, official report. 1987 and survey was done by Professor Saleh Mehman, and that revealed a prevalence of blindness of 1.76%. Major cataract being the major cause, followed by corneal opacity, refractive errors, glaucoma, and other. Another turning point, 1998, when national situation analysis of eye departments of DHQ hospital was done with the support of Fred Hollows Foundation. And see, this was the result. Only less than 300 ophthalmologists, only none of these cadres ever existed in Pakistan. Such technician, refractionist, primary eye care worker trained in primary eye care, none of them. optometrists, ophthalmic technologies, optometrists, pediatric ophthalmologists, VR surgeons. There were few VR surgeons where they had their own interest, but not regular fellowship or training. So this was the situation in 1998 and 1999. You can see now. And this was the situation of ophthalmic resources in 98. District without ophthalmic services, 46%, and without ophthalmic microscope, 54%. And this was the overall situation of ophthalmic services, and this was the cataract surgical rate we calculated at that time of 300 per ophthalmologist per year. Measure taken by Government of Pakistan toward prevention of blindness and promotion of eye health in the country with the support of international NGOs and national NGOs. First birth of Ophthalmological Society of Pakistan in 1957. Lieutenant General W. Burki was the president and Raja Mumtaz was the general secretary. Then in 1962, CPSP, JPMC, Pakistan Medical Research Council, Pakistan Medical Dental Council, and in 2000, after 2000, many universities they came forward to start a program in ophthalmology, not only for ophthalmologists, doctors, but also for allied vision sciences personnel. This was another initiative, great patronization by the President of Pakistan. The President of Pakistan was the chief guest, and for the first time, it put Pakistan ophthalmology on the international map. Ramzan Ali Sayyid, Professor Ramzan Ali Sayyid was decorated with Asia Pacific Award of Ophthalmology Joes Riddle Medal, and the President of Pakistan initiated Pakistan OSP medal in the name of Ramzan Ali Sayyid. So these were the turning patronizing point initiatives which promoted eye health in Pakistan. So National Committee for Eye Health was formulated from 1947 to 79. There was no such forum. But after the report by Professor Hugh Taylor in 1980 that Pakistani surgeons are doing less than 300 cases per year, half a cataract per day. So President of Pakistan appointed National Eye Camp Committee. It was reconstituted as Ministry of Health notified as first National Prevention of Blindness Committee, restructured as National Steering Committee for Prevention of Blindness, and in 2002 it was renamed as National Committee for Eye Health. It is still continuing with the same name. In 2011, after the 18th Amendment, finally it was 2014, it was again given under the control of Ministry of National Health Services Regulation and Control. So these are the three national coordinators which Pakistan has seen so far. The pioneer, Professor Saleh Memur, the revolution brought in the country by Professor Daud Khan. I am just carrying the work of Professor Saleh Memur and Professor Daud Khan forward. Strategy developed for prevention of blindness and promotion of eye health in Pakistan was a public-private partnership model, and it was for evidence generation, human resource development, establishment or strengthening of institution for promotion of eye health, district-wide eye care program, disease control project, integration of primary eye care in primary health care, awareness and inclusive eye health. Now this is the latest intervention being implemented. I am extremely grateful to the provincial coordinators and in Punjab particularly to Professor Zaid Kamal for uplifting this great initiative which is worldwide being taken up. And we are grateful to CBM and Sighthaber for the great support. Since 1980, National Committee through public-private partnership with the support of international NGOs has done national surveys, developed and implemented 4 national eye care plans, integrated primary eye care into primary health care, established eye care institutes. The global initiative of Vision 2020 was adopted District Comprehensive Eye Care, the effort and great result giving program of the National Committee. Provincial committees were formed, provincial CEC cell was established, National Low Vision Services established, National Survey of Cataract Surgery was done twice, the National Survey of Childhood Blindness was done, National Workshop on Refractive Errors and Low Vision, National Workshop on Rehabilitation, Task Force on Different Eye Diseases, Trachoma Elimination Program, Human Resource, along with the District Eye Care Program, this is the most rewarding effort of the National Committee for Eye Health. Subspecialty development now, and now the inclusive eye health. We are, for all these programs which we have implemented, we are extremely grateful, and we must attribute these achievements to CBM, Fred Hollow Foundation, Sight Savers, Standard Chartered Bank, AllSaid, IRISAID, Aid to Leprosy, WHO, IAPB, LRBT, Al Ibrahim Hospital, Al Shifa, Missionary Hospital, Texala, for their great contribution by supporting the institution like Pakistan Institute of Community Ophthalmology, College of Ophthalmology, Allied Vision Sciences, and Sindh Institute of Vision Sciences, and CC Cell of Civil Hospital, Karachi, Helpful Eyes Hospital, Quetta, for the Human Resource Development, District Eye Care Program, Trachoma Control Program, eye banks, upgradation of DHQs, and development of low vision and refractive services, and now we are moving towards inclusiveness. Impact of all these initiative action on public-private partnership, you can see, just compare 1998 with 2021. Look up the ophthalmologists, 1700. There are 40 ophthalmologists, pediatric ophthalmologists now present in the country. 60 vitreoretinal specialists, more than 1400 optometrists, 60 investigative oculists, they are ophthalmic technologists, 60 orthoptists, more than 100,000 primary healthcare lady health workers have been trained and retrained in primary eye care. More than 2,500 ophthalmic technicians. Sorry, this figure is ophthalmic nursing of 240. Sorry, this is not 3. And now there are 34 training institutions for human resource in ophthalmology in the country. Impact of District Comprehensive Eye Care Program. Now there 94% increase access by the female, 97% increase attendance in the OPD, 81% increase in number of surgery, 111% increase access of the OPDs by the children, 76% more intraocular lenses are now being implemented. And you can see the ophthalmic resources we compare with 1998 to current 2021. Alhamdulillah, now each teaching hospital, each district health hospital has new equipment, has human resource, optometrists, community ophthalmologists, orthoptics, ophthalmic technologies, ophthalmic nursing, ophthalmic technician, and in more than 120 Tehsil Headquarter Hospital, new eye departments have been established, along with deployment of this human resource. And we are proud that National Committee for Eye Health feels proud to share that today, if we compare the prevalence of blindness of 1.78% in 1989 to 0.9% in 2004, today we have our prevalence of blindness is less than 0.5%. Yeah. And in 2004, it was 7% in ages 50 years and above. Today it is 2% in 50 years and above, with male and female, slightly increase in female. And look at the cataract surgical rate. Professor Hugh Taylor said half a cataract surgery per day. 1999, 300 cataract surgeries per year per ophthalmologist. 2004, 2,254 was the cataract surgical rate. And Alhamdulillah, in our 2018 National Survey of Cataract Surgical Mapping revealed that Pakistan is doing cataract surgical rate is 5,307, and Pakistan is at top position among the 22 Eastern Mediterranean region and number 12 globally. So these are the area of support. You can see the public-private partnership, that this was the total budget spent during the last so many 2 decades, and 66% contribution by the government and 44% by the NGO. So summary of Pakistan journey from darkness to light is based on following general principles of global vision, and this vision was a vision of Professor Salim Ahmed and Professor Daud Saab. Genuine professional and political and bureaucratic commitment, which we achieved by strong advocacy from the platform of National Committee for Eye Health. Generous external and internal support by the international NGOs and national NGOs. Grand partnership and good governance for equity and justice. In conclusion, success of strategic planning based on evidence and implemented on public-private partnership may be replicated in other disciplines, rather taking government as a sole responsible for healthcare and service delivery. Ministry of National Health Services, regulation and coordination deserve all the appreciation for prioritizing eye diseases, eye health in Pakistan. Thank you very much.
So, to conclude the session.
جی کوئی کامنٹ یا کوشچن اگر نہیں ہے تو آئی ووڈ لائک ٹو فنش اٹ اپ ود ایک شعر ہے کہ میں اکیلا ہی چلا تھا جانب منزل مگر قافلے ملتے گئے اور کارواں بنتا گیا، اور یہ ہم ڈیڈیکیٹ کرتے ہیں پروفیسر اسد اسلم کو.
Frankly, I'm so happy the way Dr. Zahid is taking eye health in Pakistan. This is so satisfying.
اگر آپ مختار مسعود کی کتاب پڑھیں سفر نصیب، پڑھی ہے کسی نے؟ انہوں نے اپنا ایک سفر کا حال لکھا ہے، سفر نصیب، مختلف جگہوں کے سفر کیے ہیں. تو ایک سفر ہے جو کہ انہوں نے آسٹریلیا میں کیا، اور آپ کے دل کے بہت قریب ہے آسٹریلیا. وہاں پہ ایک جگہ ہے جس کو گریٹ بیریئر ریف کہتے ہیں. مجھے بھی وہاں جانے کا موقع ملا، اور آپ لوگ میں سے کئی گئے ہوں گے. وہ کہتے ہیں دیٹ از دی لارجسٹ لیونگ تھنگ وچ از ویزیبل فرام اسپیس. اسپیس سے جب دیکھیں تو وہ نظر آتی ہے، اور اٹ از سو کلرفل اینڈ سو بیوٹیفل. اس کے اندر جو مچھلیاں ہیں خوبصورت، اور وہ ایک بہت زبردست ایکو سسٹم ہے. اور لیکن انہوں نے جو بات اس سے لرننگ کی نکالی وہ یہ ہے کہ وہ چھوٹا سا کیڑا ہے جو کہ خوبصورت سا اپنا گھر بناتا ہے کلرفل، لیکن جو نیکسٹ وہ کیڑا اسی گھر میں مر جاتا ہے، وہ اس کی قبر بن جاتا ہے. اس کے بعد جو نیکسٹ آتا ہے وہ اس کے اوپر بناتا ہے. تو الحمدللہ اٹ از سو سیٹسفائنگ کہ آفتھلمالوجی میں یہ ٹریڈیشن ہے کہ ہر آنے والا یہ نہیں کہ پچھلے کا اکھاڑ دے چیزیں، وہ اس کے اوپر بلڈ اپ کرتا ہے. تو جس طرح ہمارے اساتذہ نے، پروفیسر منیر الحق صاحب نے، اور پروفیسر اعظم ممتاز قلی خان نے، پروفیسر داؤد خان نے، ان سب لوگوں نے کنٹریبیوٹ کیا، پروفیسر سالم احمد صاحب نے، اور یہ وسعت کی انہوں نے کام کیا جبکہ کمیونٹی کا کسی کو اس طرح نام نہیں لیا جاتا تھا. اور ہمارے کہ پرہیز علاج سے بہتر ہے، اور یہ ثابت ہے. 22 کروڑ کا ملک ہے، 1% سے کم بجٹ دیتے ہیں، جس کو بھی وہ آنے بہانے سے واپس لے جاتے ہیں. تو وی آر سو گریٹفل ٹو دی INGOs, those who have identified the gap between the demand and the requirement, اور اس کو وہ فل ان کرنے کی کوشش کر رہے ہیں. اور اس کے بعد ہماری یہ رسپانسبلٹی ہے کہ ہم اس میں ٹارگٹ اچیو کریں. اور پاکستان وہ ملک ہے جس میں انفارچونیٹلی ہر ٹارگٹ میں ہم نمبر 1 ہیں الٹی طرف سے. تو اس سارے پیراڈائم میں مختلف ہیلتھ ڈپارٹمنٹ میں بھی بات ہوتی ہے تو ہم کہتے ہیں دیٹ از دی اونلی ایریا آف آفثلمالوجی کہ جس میں ہم ٹارگیٹس اچیو کر رہے ہیں, اور وہ ہماری ایک یونٹی میں ہے کہ ہم نہ صرف آفثلمالوجسٹ یونائٹڈ ہیں بلکہ الائڈ سائنسز, مینیجریل سٹاف, INGOs یہ سب مل کے کام کرتے ہیں اور جس سے ہم یہ ٹارگیٹ اچیو کر سکتے ہیں. آج کے جو سیشنز ہوئے اس میں اسد صاحب کی تو ہم نے بات کری تھی, انہوں نے بتایا ہمیں کہ یہ سارا کیسے اچیو ہوا. ٹریکوما کے بارے میں جنید نے بتایا ہمیں کہ ابھی بھی شاید تھوڑی سی چیزیں رہ گئی ہیں, لیکن جیسے اسد صاحب نے کلیریفائی کیا کہ وی آر اسٹل ود ان دی ٹارگیٹ فار WHO and if we submit the dossier in time we can achieve that another target کہ ہم جس طرح پولیو فری تو نہیں ہو پا رہے, کم از کم ٹریکوما فری ہم ڈکلیئر ہو جائیں. اس کے بعد عارف نے لیا اور چکوال میں جو پروجیکٹ ہے اس کے بارے میں بتایا, اور مجھے ابھی لیا خود جانے کا بھی اتفاق ہوا, اور آئی ایم گریٹفل ٹو CBM جس طرح یہ لوگ کام کر رہے ہیں. اور آج میری چکوال میں بات ہو رہی تھی, انشاءاللہ میں چکوال میں جو پروجیکٹ چل رہا ہے ہمارا فریڈ ہالوز کا اور سائٹ سے دونوں کا, چکوال میں خوشاب میں انشاءاللہ میری بات ہوئی ہے, بلکہ کوئی وہ مائکروسکوپ کی چیزیں تھیں, اور یہ بہت ساری چیزیں ہیں جو گورنمنٹ سیکٹر سے ہمیں لینا بڑا مشکل ہوتا ہے, تو وہ INGOs یہ جو باٹل نیکس سے ہمیں نکال لیتی ہیں. اور انشاءاللہ جی یہ ضرور ہم چکوال اور خوشاب دونوں کا وہ کریں گے وزٹ اور دیکھیں گے خود بھی, اور اپریشیٹ امید ہے کریں گے. AJK کی بڑی اچھی باتیں بتائی ہیں فاروق مان صاحب, ہمیں سیر بھی کرائیں نا وہاں جا کے ہم, تاکہ بچش میں خود دیکھیں. تو میرا خیال یہ سارا ایک وین ہم سر عارف صاحب ایک وین ہم ارینج کر لیں گے پہلے, تو انشاءاللہ ہم سب چلتے ہیں وہاں سے, آپ ہوسٹ امیدہ کریں گے. تو آپ سب لوگوں سے میں یہ کہوں گا کہ جس طرح اسد صاحب نے بتایا کہ کچھ چیزیں ایسی تھیں جو کہ ہم اس انداز میں نہیں کر پائے پہلے, لیکن میرا خیال ہے اب ہم اس لیول پہ آ گئے ہیں کہ جس طرح ہم سوشل میڈیا کو یوز کر رہے ہیں. شاہد مقبول صاحب بیٹھے, ہم ساری ایکٹیویٹیز, اور یہ آج کی بھی آپ لے لیجئے گا, اور یہ ان کے وہ ہم چھوٹے کلپ بنا کے YouTube چینل کے اوپر ہم یہ ڈالتے ہیں تاکہ لوگوں کو اویئرنیس ہو کہ کیا ہو رہا ہے, اور ڈیزیز پریونشن کی بھی اویئرنیس ہو. تو انشاءاللہ یہ سب کچھ وہاں پہ ہوگا. اور آخر میں ڈبے کھل گئے ہیں, تو میں سمجھ رہا تھا لنچ باکس آئے ہیں, لیکن نہیں, یہ اور بڑا خوبصورت اس دفعہ آنکھوں کے اس سے انہوں نے بنایا ہے لوگو, یہ سجانے والا اور رکھنے والا ہوگا. اور آئی ووڈ تھینک ایوری بڈی فار بینگ ہیئر, اور میں ریکویسٹ کروں گا کہ آپ سب لوگ ایک ادھر آ جائیں تاکہ گروپ فوٹو آپ کے ساتھ, یہ پیچھے کی لائٹ آپ بند کر دیں تاکہ گروپ فوٹو اچھا یہیں پہ